everyone. I am Dr. Thamarai, practicing in Pro-Life OG Clinic, which is exclusively an OG clinic. In today's topic, we are going to talk about scans in pregnancy, what are the importance of scans and what kind of scans have to be done and when it has to be done. So, ultrasound scans are the highlights of the pregnancy. It's exciting to see your baby within the womb. So, very common questions what people have are how it is done and how long will a scan take, and will the reports be given immediately, or does ultrasound harm the baby? Ultrasound definitely does not harm the baby, and how it is done is either transabdominal and transvaginal initially in the first few scans, and then later most probably it will be a transabdominal scan. And how long a scan would take depends on the position of the baby and depends on the each individual women. So it might most probably it would take about early pregnancy scans would take about 5 to 10 minutes, and then first trimester and second trimester scans would take about 20 to 30 minutes depending on baby's position. And results usually immediately after the scan is completed, within half an hour you should be able to get your results. And can I take a photo of the baby? That is what most women want to know. But photos and sex of the baby cannot be revealed according to the PCPNDT Act. So definitely it will not be revealed. So please do not ask about the sex of the baby. Now let us go about when do we start the first scan. The first scan is called as dating scan, and it's preferably done between 7 to 9 weeks. Earlier, unless it's indicated, if the patient has pain or bleeding, we can do it a little bit earlier, or preferably around 7 to 9 weeks, when we can see the location of the pregnancy, the number of fetuses, and correct dating of the fetus pregnancy depending on the menstrual periods and depending on the scan, and to check for the heartbeat of the baby. So this scan is mostly done transvaginal, and then it usually takes about 5 to 10 minutes. And it's a simple scan, nothing to worry about a transvaginal scan. The second scan would be the first trimester scan, that is about 12 to 14 weeks, also known as NT scan or first trimester scan. And usually in this NT scan, we can detect about early anomalies, and we detect Down syndrome risk. Screening test will be done along with a blood test, so we can predict the Down syndrome screening. This scan will take about 20 to 30 minutes, and then it also depends on baby's position. The next important scan in a woman's life is about anomaly scan or target scan, which is done around 18 to 20 weeks. And this scan is mainly to look for all the anomalies in the baby and to look for the growth and well-being of the baby. And the following scans would depend on each individual woman's growth and examination. Most probably we would need a growth scan around 32 to 34 weeks. Unless clinically warranted, we might need earlier and later scans. In the growth scan, we would look for the growth of the baby to see how much the baby has achieved the growth from the previous scans, and to look for the Leica around and the heartbeat. And a Doppler scan would be needed if necessary. So for most people, ultrasound is a happy event, and to look at the baby in the monitor and to look at the heartbeat is very, very a happy event. But maybe a different scenario, because not all patients will have the same outcome. If there is a negative outcome, then we can decide what has to be done later according to the results. Thank you.